back. Sorry, my keystroke isn't working all of a sudden.
We
Shit. And now
may be experiencing technical difficulties, but we will get this sorted here just momentarily.
your mic is live now. It's just showing a whole. We didn't go. Just go ahead.
All right, so we've got a couple of technical difficulties that we're working through, but my name is Rory, and I am your candidate for Thurston County Commissioner, District 1. Today on County Conversations, we are going to be discussing healthcare from the front lines of COVID. We're going to be having Mary Ellen with us today, and she is going to be talking about some of the experiences she's had both now and previously in the medical field, and speaking to some of what she sees as our needs going forward within our community and for our providers. And we're going to have a quick discussion about budgetary issues going forward as well. And so with that, I'm going to say, Mary Ellen, how are you doing today? Could you go ahead and give us a brief rundown of some of your educational experience and some of your professional experience?
Yeah, absolutely. Hello, and thank you for having me on. This is my first time doing something like this. So yes, so my name is Mary Ellen Biggerstaff. I have a doctorate of nursing, and I have 10 years experience as a nurse practitioner in rural healthcare as well as opiate treatment. And I also am an assistant professor of nursing practice, and I am completing my master's in public health at UC Berkeley. So really wanted to talk a lot about public health and my experience as a clinician as well. Yeah.
Fantastic. So as a nurse and somebody with your extensive experience, you handle both medical matters and are responsible for humanizing patients' experience with the medical system. And so what is your opinion on balancing the needs and expectations of citizens while with all the necessary safety guidelines we have right now?
Yeah, I think that's a good question. And I think it's also something that is changing pretty regularly. I mean, I think week by week, we're kind of experiencing something a little new. From a public health standpoint, Governor Inslee has really done a really great job of taking things very seriously and working really hard to protect the health of people in Thurston County. I mean, at this point, we've only had one death in the county, which is really extraordinary compared to a lot of other places. I know that doesn't come without a cost, but I think right now, it is wise to be cautious and be taking the precautions we are.
Yeah, I'm right there with you. I'm fully supportive of a lot of the measures that have been put in place and trying to maintain a sense of responsibility to our fellow residents and our communities as we struggle with COVID. And so as with political gatherings, socialization and recreation, there's been a lot of social distancing requirements and things that even myself as a candidate for county commissioner have been fully supportive of and would have liked to see more of. I think that there was some premature discussions about reopening certain things in terms of trailheads and such, and not really being reliant enough upon our medical providers and our professionals that work in the medical field and on public health issues on a regular basis. So that being the case, how responsive do you think public health authorities have been here locally?
Yeah, well, Dr. Yu has taken over as the acting public health director, and she's done a really great job. I know she's extremely well respected in the community, and everybody was really glad when she kind of stepped up. And I think that through Facebook and social media, they've also done a really good job of communicating with people what's going on and how the decisions are being made. So, yeah, I mean, it's nothing about this is ideal. I don't think anybody likes it, but yeah, I think they're doing a really good job.
Right. So one of the concerns that I've had here locally about business is that, on the business side of things is that the question being is, are small businesses, larger businesses, facilities, health authorities adequately prepared to do the phased reopening that we're looking at right now? In terms of business, what I have heard is that a lot of small businesses here locally are concerned about even being able to gain access to PPEs. And so PPEs, personal protective equipment, stuff like masks and gloves, stuff of that nature that help protect not only yourself, but the people around you from contracting COVID or any other myriad of issues that might come from not having protective equipment. And so I'm a huge proponent of making sure that we have really strong resources in those areas, adequate funding, and a push to really assess how prepared we are with that in mind. And so where do you think we can improve as a county in terms of our local health authorities in terms of PPE?
Yeah, there is not enough. And that working in a primary care clinic, we're reusing masks and things like that ideally we wouldn't have to. Luckily, it hasn't. The numbers haven't been so high that it hasn't felt like this super acute situation. But I know many dentist office, for just example, as a very necessary medical clinic opening up, they have donated a lot of their masks and equipment. So there isn't really even enough PPE in our primary care clinics and in our hospitals to really meet the demand of what there is now. So how do you roll that out so that people have that in the community is a really good question. And I don't think that's through any fault of anybody in the county health department or anywhere else. There, because of just-in-time stocking and supply chains, there just isn't enough in the U.S. as it is.
Right. Yeah. And I totally echo that concern as well. It's just that there's just not enough available. And as people begin to reopen their businesses, and even as healthcare providers return to work in certain sectors of the healthcare industry, they themselves are finding that the supplies are really low. And so getting a hold of any type of PPE has become exponentially more difficult. And so is there anything that you think we should be doing differently right now in terms of sourcing those supplies? Myself, I haven't found that we have any options really because of those supply chain issues that you had just mentioned.
What would be nice, and I don't think this is anything have as control here, is that we had it more federally organized. Right now, PPE is going out on kind of a market-based system. So people are bidding, people are trying to find it and source it and write contracts, and there's a lot of price gouging going on and things are going off. So I really, I mean, that sounds a little redundant to keep on saying, well, we're kind of a victim of this federal failure and the system not working very well. Because I really do think we're doing about as well as anybody else is in the entire country. There just isn't enough right now. So I don't know what, I don't have any suggestions about what people could do differently to make it better in the moment.
No, that totally makes sense. And in terms of how I view it, it's I have heard that a lot of our local PPEs, there's some discussion about how to allocate them. The county itself has distributed PPEs to local departments, and my big focus would be obviously giving the necessary PPEs to medical staff and providers first and foremost, and making sure that they are prepared for these challenges in these times, and then doing an equitable distribution of what's remaining after that to other departments like the police department and stuff. I want to make sure that everybody who's out there contacting the public is safe and has the equipment that they need, but definitely we need to make sure that we are directing the resources to health providers because they're the ones that sustain the most direct contact. And you had mentioned briefly that our numbers have remained really low, and I agree with you. They have. We're at 107 cases right now, so far as I'm aware, with only the one death, which is remarkable, as you've mentioned. But I am also concerned about testing capacity and how well we have been able to meet the need for testing, how well we've been able to meet the need for contact tracing. I know Inslee has had some discussion about directing even agencies like the DOL to help with contact tracing. Do you think that the county here locally needs to be having a stronger conversation around testing capacity and contact tracing, even within our own communities?
Yeah, if we as we open things up and as the economy, things open up, we are going to have that conversation. So it's definitely improved over the last month with what we've seen. Right. Initially in clinic, nobody could get tested unless they were hospitalized, and there was just no other options. And now Providence and some other places have been doing testing for active cases, And also they're starting to do antibody tests. We don't really know how great the antibody tests are, but that's where you can test and see if somebody has had the infection and recovered. And we think those people should be immune, although we don't really know. And if we're going to open up the economy, and kind of that's what Wuhan did after they controlled the outbreak, is they did extremely strict contact tracing, which is really labor intensive, which goes, you get one positive person, you find out everybody that they have contacted with, and you test them or pull them out and say that they need to be in isolation. So that is, I don't know if we, I don't think we're quite ready to do that yet on a countywide scale, but hopefully that will be in the near future.
Right. Okay, great. So then I guess my next question for you would be, and this is something that, I would love some feedback from you or questions from you on as well, is have you or any of your colleagues that you're aware of reached out to any political offices with comments, questions, requests, concerns? And what has that response been?
I have not directly as a clinician, but I know that the CMO of the hospital they work, the chief medical officer who's kind of in charge of that, has been working hand in hand with kind of the government. I know I work at a clinic in Elma, and so he has spoken with Representative Kilmer, and other representatives are working very closely with kind of the executive level at the hospitals. Otherwise, clinicians, I don't know that there's been that much advocacy that I'm aware of.
Okay. And so then, the follow-up to that is what would you expect out of a county commissioner in this time?
I think that's actually a great question. I know that as the public health officer is the person that we look to directly from the medical and clinical community. We look to them for answers. And I don't know that I actually don't know that I've heard a ton from many of the county commissioners. So maybe actually that'd be great if you want to explain a little bit more about what we could expect and how they would respond in their capacity.
Yeah. Well, and so my understanding of it is right now is that our 3 county commissioners obviously sit on the board of health, and so in that capacity, they are a large voice in advocating for the direction and vision of our public health and social services. And so the county commissioners are then able in that capacity to, push public health in and say, we believe we need these resources allocated here. We believe we need these resources allocated over here, and create a really collaborative conversation around what resources are available and which ones aren't, and help to frame that discussion within, with budgets in mind and how to meet the needs of the community. And so a lot of it with the county commissioners actually comes down to providing vision and direction, more so than having any direct control. Obviously, my hope and me as an individual and running for this position, I would hope that our county commissioners are consulting very regularly, but not only that they're consulting with medical professionals, but that they individually are taking that information and dispersing it to the constituents. I think that more direct outreach from your commissioner is absolutely necessary. I see that some of our commissioners are out in public right now, saying some pretty inflammatory things and not necessarily deferring to the expertise of medical professionals. And so for me, it would be really this idea behind promoting that expertise, right? Really having a conversation with voters about why we can rely on medical professionals to make these decisions alongside us and to guide our county in a healthy way. In terms of the budget, what the county commissioners do is they do obviously the budget approvals for the different departments. One thing I have seen is that the budget, the funding revenue streams have dropped in 2020. And it's been a pretty substantial drop across the board for public health. And so that's everything from like environmental health to, social services, drug treatment, various, treatments for diseases of despair, which is something that we have seen increasing even before COVID, but now will be increasing even more. Mental health services is something that I'm really passionate about myself. And so it would be my goal as the county commissioner to actually be advocating really heavily for increased access to mental health services, increased awareness about mental health. I know that the county commissioners and the Board of Public Health and the public health department itself does, believe it's May is the Mental Health Awareness Month. But I think really it should be a year-round push, increasing awareness, accessibility, and funding for those services. But I think that that's something that's going to touch on more than just COVID. You know, that's going to address all of our public health concerns holistically. We see in our unhoused population that the number one driver of being unhoused right now is actually mental health, and what the level of accessibility is. And then if you take that in tandem with COVID and people losing their jobs, not having any real wage stability, not seeing adequate response from ESD right now, in terms of timelines, you know, there becomes that added pressure on people in our communities. The added stress then creates, you know, situations of depression and drug abuse and possible suicide. And so those are things that I would like to see the county commissioners pushing much more heavily towards, in their capacity on the board of on the Board of Health, making sure that we are actively directing resources to counteract those concerns, right? And so I think that a lot of people are of the impression that our funding is constantly increasing in the county for all these services, and in reality, they're not. It has been a very substantial decrease in funding for public health services. I think, you know, when we look at the drivers, the things that are actually bringing in the money for these things, you know, it's things like septic system applications, time of transfer applications that get processed, solid and hazardous waste facilities that are inspected, and the fees that are associated with that. And so I think there needs to be an additional push on the funding side to make it possible for us to increase services on the health side. And I would also love to see the county commissioners having a really, really deep discussion about, you know, is it appropriate that our law enforcement is seeing a much larger segment of our funding than our public health sector? And so that's a really big concern for me. When I think about what we can be doing going forward, a lot of that has to do with how are we going to have the conversation in a way that is experiential. And so what I don't see so much of is people that have experience firsthand with a lot of the struggles we have in our community. And so, you know, a lot of it solution wise from commissioners comes from their vision, what they want to see in the community, and what I want to see is a 100% increase on attention and funding for public health. I think that that's absolutely essential. And then, so then I wonder, did you have any other things that you wanted to know about, you know, where I stand as a candidate, or where I think the county commission should be going in terms of public health?
I didn't have any direct thoughts, but if it's okay, well, one, I completely agree with you. I mean, that's not surprising that that's my experience. That is my profession, and I'm a huge fan of public health. And it isn't just in Thurston County; it's been really across the country. There's been a slow and steady decline of public health and funding of public health. And I don't think the problem with public health is often you don't see it until it's too late, and then you realize, like, oh wow, we should have been doing this all along. It's not a very glamorous. I mean, it's just not a very glamorous work a lot of the times. But so I completely agree. And I did also, looking at that there was, you know, it looked roughly on the budget, there was about $90 million every year that went towards economic development, 90 million that went for law and justice, and 30 million that went for public health. And public health touches all sorts of different fields, and kind of you can tie it into almost any aspect of our life. But if you're talking about especially mental health treatment, substance abuse treatment, those are things that could be running out of a public health department on a large scale. And I think the public health departments in the state overall are quite underfunded compared to, say, I've done a lot of work in Oregon, and seeing some of the public health departments there, that they have full running primary care clinics, mental health clinics, dental clinics that are running in every county, and those are robust and providing a lot of needed services. So you have the preventative medicine, you have the treatment, and then you have just the whole shebang of primary care that is really needed. So, and I think that is not only like the right thing to do, because that's where we'd want to be putting our money into preventing problems before they get worse, but it's also the fiscally responsible thing to do, because we spend way more in the US on aftercare and later on care for people, chasing people's health problems, when if we put more into prevention, we would save a lot of money in the long run.
Right. I totally agree with you. You know, I think one of the things that I've noticed is that, and I think it's also pretty common knowledge for a lot of people that, you know, policing is not necessarily a fix to some of the situations that we have in our community, whereby if we had increased funding for mental health services or other health services, you know, we would see declines in the need for some of our law enforcement funding in terms of how many people are being required to go to court hearings because of some issue related to mental health, or you know, how often are we having to use our law enforcement funding to address a domestic dispute that could have been addressed with public funding of public health. And so these directing money more towards health services actually saves us a lot of money in law enforcement. And so that way, in that way, we can start to shift our budgets closer, more towards public health services and away from law enforcement as we are able. Obviously, that's not something that would be an overnight shift, but I think it should be our goal. Our vision going forward should be, how do we create a situation in which we have less dependence on law enforcement? How do we increase diversionary treatments or options, I should say, diversionary options, and how do we prevent the need in the first place? And the answer to that, more often than not, is health services. So right now, I think, you know, I think we've had a really poignant look at what the state of public funding is right now for healthcare and what the real need is. I think you can walk down the street in any given densely populated town center in all of Thurston County, all throughout the nation even, and see the impact of people not having access to healthcare. You can see people on the streets for you know, having issues related to mental health that were the result of just not having enough money to get their medicine, or having enough money to go in and do an intake. So like an intake for mental health services is often $250 or more for just an hour. And so it's important to take those things into consideration. And then also I want to see us reducing barriers for providers coming into the area. You know, nurse practitioner startups, but also mental health startups that are trying to bring services in terms of mental health. And so, yeah, I just wanted to say here at the end of this conversation, Mary Ellen, that I really appreciate having your expertise on with us today. It means a lot to our community to have such amazing professionals and insights, welcoming the discussion and advocating for a push for public health. So thank you so much for your time today, and we will talk with you again soon, I hope. And we'll go ahead. You were gonna.
I was just going to say, no, I was just going to say thank you very much for having me on. If anybody wants to talk about public health, I really like talking about it. So I can do that for a long time. So yeah, awesome. And just everybody stay safe out there.
Awesome. And so, we have down in the description below for the YouTube video, we will have a link for Mary Ellen, because as you see with the Mary Ellen sign in the background during the video, Mary Ellen is also running for LD22. We will have links for her, as well as some more resources and links, informational links for COVID and how to get more information about the budget here locally, and also links to our public health services and related departments. That'll all be in the description in the video. We also want to make sure that we are pointing out that we're going to have a bunch of live streams coming up here in the near future as well. We are going to be talking with Glenda Breiler on the 5th. And Glenda and I are going to be discussing tribal leadership and how to best engage tribal communities from our local governments and creative collaborative discussion. Beyond that, we're going to have discussions on housing with Jessica Bateman, and also with the unhoused population with Charlia Messenger. And then we're going to be talking about labor in the future, in the very near future as well. And so I encourage you to watch our future videos. We will keep you updated when those are going to go out. You can visit my website at www.voterory.com to sign up to volunteer, to donate. You'll also see at the very top of that website, there is a phone number, which is 360-789-2173 is the campaign's phone number. You can call and have with any questions that you might have. And then additionally, you can send an email to info@voterory.com if you want to ask a question for one of our future videos, or if you wanted any additional information about me as a candidate or the campaign. So thank you everybody for joining me today. I hope you have a wonderful day. Go out and enjoy the stormy weather. It was kind of cathartic for me to see it today. Actually, I like having seasons here in Washington, so it was quite pleasurable to see the rain this morning, for me at least. So I hope you're hanging in there. Stay home, stay safe, and I will see you soon.